Good morning. It's been so long since I was referred to as Miss, you know, it makes me feel young again. The fact is that I'm a veteran journalist and author, and veteran is code for I've been doing this longer than a lot of you have been alive. And then I was touched by a magic fairy, the night chair, and turned into a journalism professor. It's magical, I tell you. So my mission at the University of Georgia is to improve the flow of information about science, health, medicine, and health care to the people of Georgia and beyond in the South. And my method is to train reporters and health communicators who will be helping you, your loved ones, your neighbors, stay better informed during the coming years and hopefully make better individual decisions. So here's this cute thing. So in the keynote, oh, there's my first slide, look at that. In the keynote, Nancy Brown from the American Heart Association urged us to engage communities, not to just let them sit out there unbothered by us. Oh God, that's not what there we go. Look, like magic. So I joined the UGA faculty in 2006, and they didn't have any classes in health journalism or medical journalism. And I was tasked with building a master's program from the ground up. And that worked pretty well. And in 2009, it was recognized as a freestanding concentration, and we began to enroll our own students. And then just about 6 months ago, realizing that the trend in colleges of mass communication is for a softer, a blurred line, as it were, between journalism and public relations, we created another major that allows students to learn the skills of health journalism and the skills of public relations together. As Mark Wilson mentioned yesterday in his talk about workplace interventions, we live in Athens, Georgia, in Clark County, which is a county with an extraordinarily high poverty rate when you consider that we're the home of the flagship university. We have about 28 to 30% of our population living below the poverty line. Now, as a hub of higher education with the UGA and healthcare, we have two major medical centers in Athens. We are really kind of an anomaly surrounded by poor rural counties where there are many underserved populations. And the health disparities in these counties are pronounced. And the most common chronic diseases, as you might imagine, such as diabetes and heart disease, are of course related to obesity. Health habits, as you've heard so often here, are formed quite early in life. And structural factors in local communities have a big effect. So students in my program, they go out into the world and explore many of these structural and social and individual factors that determine the health status of the people. As our webpage says, we're really all about empowering communities. So how do you do that? Well, you get your students off the campus, for starters. You turn them into one-person news bureaus, and you send them out into the hinterlands. Now, here I have to express great gratitude for the UGA Extension Service, because when a student who may come from Cincinnati or someplace is sent out to Jackson or Barrow County, Georgia, they need a friend there. And the UGA Extension agents have often been their touchstone, the place where they can get a cup of coffee and go to the bathroom if they need to. And really, that helps, honestly. When they get out into these counties all by their lonesomes, they stumble across stories that would otherwise absolutely never be told. For example, if you were to leave here on I-85 and drive north, take a couple of back roads, 49 miles to Fort Yargo Elementary School in Winder, Georgia, it's already 8:30, you would be way too late for the 7:15 running club. Now, the running club was started, this is a story by a graduate of my program, Lacey Avery. The story was published in May 2012 by Georgia Health News. That's the logo across the top. And that is a statewide, daily, nonprofit news organization that covers health, healthcare, and policy in Georgia. Now, other nonprofit news organizations like this exist in nearby states. If you're from Florida, you have one there. If you're from North Carolina, you have one there. I'm not sure about all the states where you live in, but if you have one of these nonprofit dedicated health news organizations, you might want to start reading them. I tell you, they are very, very valuable. They're doing things that traditional legacy media are no longer doing. And you also might want to donate money to them because most of them are running on a shoestring. So this particular story, the Running Club story, highlighted Pam Rogan, who's a gym teacher in Barrow County. And she started this program of her own initiative in 2010. Nobody told her to. She just had the idea that this might help with the obesity rates that she saw rising among elementary school children. So Lacey was able to get this story published with a news peg because the governor of Georgia at that point had just announced that he was going to be committing a little more money to school-based exercise programs. Not enough, we would probably say. Here's another story that I don't think would have gotten out there without one of these students. Now, the seed and plate is what we call entrepreneurial journalism. It was started by this student, Jody Murphy, who wrote this story. She wrote about the Young Urban Farmers Development Program at the Classic City High School in Athens. Now, Classic City is what's considered an alternative high school. It's for kids who weren't really thriving in the traditional mainstream high school. But with the help of this teacher, Bantu Gross, he's the tall man in the back left, these students are learning business as well as agricultural skills because they have a market garden and they have to figure out how to make money selling their vegetables at local farmers markets and restaurants. And these are youths who come from very low-income neighborhoods where they are a lot closer physically to fast food outlets than to full-service grocery stores. So this program has really been, I think, a revelation to some of these young people. And here you have, again, a young man, a teacher with an idea, just like the gym teacher in Barrow County, and another great role model whose story might never have been told. This past spring, another of my students, a first-year student named Hyacinth Empanado, fanned out into her county. I had 6 students. I sent them to 6 counties. And she met there Chef Josh Aaron, that's the man with the beard in the picture, and the staff at North Jackson Elementary School. Now, they run an amazing sort of a wrinkle on the farm-to-school program there. And I want to show you some kids coming face-to-face with something they haven't seen before.
We're at North Jackson Elementary School, and today we served a salad of what we call a local lettuces salad. It's got strawberries and apples, Parmesan, Italian dressing, and the chicken was also a boneless, skinless chicken breast that was marinated in the Italian dressing in advance. So it made it really tender, and that was what made it pretty much to the point where the knife would just slide right through it and fall apart.
Come on down, guys. Come get you a spring salad.
One of the best responses was one of the girls was actually licking the plate. She enjoyed it so much.
That's good.
Above and beyond the rest of it, one of the best things was the reaction of such a large majority of kids.
What do you guys think about the salad once she's set up, okay?
The kids were in a huge response, enjoying it overwhelmingly. And I think I only saw about 4 or 5 kids out of a whole group of 6 classes that had tried some. But the great thing is you then have a chance to talk to those kids and let them know, hey, it's okay that you tried it and you don't like it. Just try vegetables when they come along and see which ones you do enjoy.
I was a little nervous because I didn't know how they were going to respond to it, but I think the general response, because the salad was very pretty after we put it all together, and the strawberries and the apples, and kids love strawberries and apples and the colors, so I thought that the appearance of the salad made the kids want to eat it, and so they all came through and they were very happy and excited.
They love it. I asked how they like the salads, and I've had many students say they loved it. It was delicious. They've never had fruit in their salad before, but they don't want another salad like that without fruit again. So it was awesome. We had a good time.
I think it's great. It's something I wish we could do more often. The students are excited, the faculty's excited, and it's nice just to see our students eating fresh, healthy foods, and also working with our community. Chef Josh having a local business, it's good for the school and the local businesses to work together.
All right, that's kind of fun there. So as you know, children are not the only ones who struggle with weight or obesity-related health problems. And here, grad student Erin Hale told the story of Barbara Haynes, an Athens resident who helps members of her church family manage diabetes and other obesity-related illnesses. Now, how does Haynes know how to do this? Well, nurses taught her how to measure blood glucose, to test blood pressure, to provide basic nutrition and healthy cooking advice through an educational program run by the Athens Health Network, which is a coalition of local service providers and university people, including me, who want to make healthcare more available to people in our community. Now, all these stories written by these students wouldn't mean anything if nobody read them. But student reporting reaches more people than you might imagine. Here are some of the local and national publications that have published print and video stories generated by UGA health journalism students, which I think is pretty good for a program that's just been going on for a few years. Now, in some cases, I have gotten out there and brokered arrangements with the editors, or informally or formally, that they'll look at stories by my students. But you know, in other cases, it was the students who took the initiative. Scientific American Online is an excellent example. I had a student 3 years ago who managed to insinuate herself on as a blogger, and now I have 2 other students who have been paid bloggers for Scientific American. And the more your students get a reputation for being good at something, the more chance they'll have to do that thing. So we feel really good about these university private partnerships. As you can see, a lot of the stories, the ones that I've shown you so far, mainly give voice to people in communities who would have been voiceless, regular citizens. But, you know, a second category of student work deals with seeking to engage readers and communities around research that's done on our campus at our very own research university. Now, as you probably know from earlier presentations or from visiting, perhaps you've been to the UGA booth downstairs, UGA launched an ambitious interdisciplinary obesity program in 2012. And I've been part of it all along. And this collaboration is big. It involves about 150 faculty members from 13 different schools and colleges. So far, and this is where my students come in, so far 3 of the health and medical journalism students have generated press releases, video releases, and multimedia features about obesity-related research and community initiatives. Now, the Office of the Vice President for Research has made that possible, David Lee and Terry Hastings, because they've hired my students as graduate research assistants. Now, in this setting, the journalism students get to practice the craft of science writing, overseen by experts and in close contact with the scientists that they're writing about. And they really get to connect closely with scientists and communities and consumers alike. And stories like these help UGA, which is a land-grant school, live up to its land-grant mission. Here are some of the stories that they've written about UGA research. And as you see, of course, we get a dog meme into this. We even write about research at our veterinary school, which does many wonderful things. So now you've seen some examples of media coverage that can raise awareness and stimulate engagement in communities about obesity prevention and obesity-related health problems. So now I'd like to just tell you, in closing, a couple of things that I've learned from working with these students on these sorts of issues. And I guess the first thing I would say is, whether you teach journalism, kinesiology, public health, nutrition, or genetics, it's a good idea to talk about obesity, to get it on their intellectual radar, beginning with the introductory classes. Don't wait until some advanced class. For example, in the fall, I teach a course called Graduate Newsroom. Now, this is designed for graduate students who come to us saying they want to be journalists when they grow up, but in actual fact, they have no previous training in journalism and they have no experience as journalists either. So this class deals with the basics, the practice of ethical journalism, the fundamental skills of the multimedia journalist, and it offers them a lot of practice telling stories using text and visual platforms. So I've come to conclude that it's very important, even with these beginning students, to get them out and around. Don't keep them in the house. So in the fall of 2013, the late Dr. Cliff Bale and some other leaders of our obesity initiative helped us get press passes for 9 student reporters and me, so we could participate in the world's largest gathering of obesity experts in the country, Obesity Week 14, which happened in Atlanta that year. And there are many lessons to be learned from reporting on a meeting with 20,000 participants in a giant convention center. Among other things, they learned that there are never enough wall outlets in the press room, and that sometimes you will be working in the atrium of the World Congress Center. That was our little press room. So you also learned to write on assignment. So part of the deal for getting the free press passes was that each student wrote a news brief for the Obesity Week website on a topic assigned them by the organizers. So they didn't have a choice about that. And also during the meeting, they attended sessions and interviewed experts and reported a story of their own choosing, which they turned in to me as a class assignment. And this is an example of a news story about the labeling of obesity and how that would affect insurance coverage that I don't think would have gotten told, certainly not in Athens Patch, if it hadn't been for this experiential learning adventure at the Obesity Week. Now, if any of this appeals to you, I've come to realize over the last 2 days that as a journalist, I am really an oddball here, like a skunk without a stripe, or maybe I am the skunk with a stripe. Anyway, I'm an oddball here, and there are not many journalists in this room. I know that. But I also know that most of you teach at institutions that do have journalism schools or schools of journalism and mass communication, and you can try to activate these people. Surely you know some journalism professors. Maybe you've had a run with one of them. So if you want to do this, or you want to inspire somebody you work with to do this, there are just a couple of tips that I would have. That page with the logos on it, that's really important. You want to forge media partnerships. You want to have friendly editors who are ready to look at student stories and are ready to work with students. Our association with Georgia Health News has led to the publication of my student stories in tiny newspapers all over Georgia and on the websites of little TV stations all over the place. It has also led to their stories being pushed up to a large national audience on Kaiser Health News, something I hope you read. There's a little downside that goes with that, of course, and that is that if you're the professor, you must run interference when interference is called for. For example, one of my first-year students during the obesity reporting exercise had a bad factual error about the health status of a regular citizen that she had interviewed for a story, and he wrote to the online news outlet, it was also Patch in this case, an outraged letter about what an incompetent and terrible reporter she was. The editor demanded a correction, which was of course right. The student dragged her feet because she didn't really want to own her own mistake. And I had to intervene. I had to make sure that the correction happened, and I had to make sure that the editor still trusted us. So, there are those moments. But that aside, that's a small down in the whole big picture. But I really think the rewards of doing this kind of coverage are huge. It's not enough It's not enough to describe problems, to say we have problems with obesity. But if you can tell stories that spotlight local heroes, innovative ideas, places that are finding success, then you will give people hope and inspire them to get involved with this. And student reporters filling gaps in media coverage can strengthen ties between your university and your community and bring you closer together. So that's all I have to say, and if I have a minute for questions. One in the back right there.
I have a question about directing your students when there's pushback from media that might say there is no story here. I appreciate that they're having an opportunity in the small town to report on programs that really lighten my heart that are happening in communities.
Yeah.
But often their media is looking for provocative, sensational, publicly charged, different kinds of lens for what's going on in America in health today. How do you help the students find and cajole and get the great news stories out that you described today?
Well, students are really enterprising as reporters, and I've just showed you their work on obesity. I have not showed you their reporting on enrollment for the Affordable Care Act. I've not showed you their reporting about the brouhaha over whether UGA should be in the business of having health navigators. I haven't showed you the large investigative piece that ran 2 weeks ago that essentially held public health officials accountable for being insufficiently concerned about elevated arsenic levels in private wells in a rather politically disempowered part of South Georgia. So my students do hard-hitting investigative stories that not everyone wants to see published, but we found that editors are publishing those, and it's a great experience for them. You know, obviously an editor gets to make a decision about what they want to see in their publication.